In ancient civilizations, people survived the plague, smallpox, measles, and polio. But no one survived rabies. Even today, untreated rabies is fatal. That is why rabies awareness is important to people, pets, and the community.
Rabies is a zoonotic disease, meaning it can transfer from animals to humans.
Well, rabies is a virus. It's shaped like a bullet and has spikes on it.
Caused by a Lissa virus, and that's a type of virus. And rabies, once you're infected with it, is almost always fatal.
How is rabies transmitted?
Get rabies if you get bitten by an animal.
With very few exceptions. And it is transmitted to other animals or people by an infected animal's saliva, either from a bite or a deep scratch.
You can get it through the mucous membranes if you're in a cave where there might be bats and the air might have the rabies virus in it. Could be transmitted through your eyes or your mouth, but the vast majority of cases are through a bite wound.
This virus attaches to muscles and nerves, so it'll attract into muscles and then attach to a nerve. Those nerves then send messages and take it to our spinal cord, and as the virus progresses, it moves up the spinal cord. Once we get to the brain, it starts to multiply rapidly. And that's the problem with rabies, because at that point we cannot stop it. So we need to treat early. If it gets to the brain, it's fatal.
What are the symptoms of rabies?
Well, the rabies virus causes an encephalomyelitis, inflammation of the brain and the whole spinal cord and the nerves throughout the body. So often within a few days they would become disorientated, great changes in their behavior, and then it develops into either a furious or a dumb form, where the animal acts very agitated, might even try and bite at the wound, and would sort of snap at imaginary objects. If you bother it, it would bite you, and then it goes from there to a dumb form where they just become very, very sedated. Might even start seizuring, and then often will die within a matter of days after that, because it paralyzes the respiratory muscles, and they go into a coma and stop breathing.
The symptoms of rabies are fever, headache, excessive salivation, where you have a lot of saliva, muscle spasm, difficulty swallowing, mental confusion, problems with sleeping, hallucinations, even paralysis and death. The symptom of rabies is an interesting term, hydrophobia. The definition of that is fear of water. The reason that this happens is the patient has trouble swallowing. So they become fearful of water, and it has a different taste. They complain about the way that the water tastes. So it's a fear of the water, it's pain with swallowing. So that's where they came up with the swallowing issues with rabies and the term hydrophobia when we talk about rabies.
What should you do if bitten or scratched by an animal? Get their saliva in any open wound, even an open pimple. Get their saliva in your eyes, nose, or mouth. Wake up with a bat in your room, or a bat has physically run into your body, or a bat has flown close to your face. Promptly wash the bite wound and any saliva from the animal that is on your skin with lots of warm, soapy water. Use an antiseptic. Then seek medical advice from your physician immediately. Also contact the CDC. They are experts on rabies. If bitten by a stray pet or wild animal, call animal control or the police to capture the animal.
Timely treatment is essential in treating rabies. If you don't know if an animal was rabid when it bit you, you should report to an emergency room or your physician immediately.
To think that I never know it was actually fatal. I didn't know you can die from it. And what are the treatments for rabies?
Timely administration of immunoglobulin shot in or around the wound. Then a second shot is typically given in the shoulder. Finally, 3 or 4 shots are given in the arms or legs over the span of a month.
So if you're bit by either a dog or wild animal, your first step is going to be to call animal control. They'll put you in touch with the Department of Health. You will file a bite report, and they will follow up either with the owner of the animal that bit you, or if it's wildlife and you have that wildlife, if you have, the groundhogs that you were talking about, if you have them confined, you can call and they will send animal control to pick up that animal and have it tested. So you absolutely can go to the doctor, but typical protocol, so say you're bit by a dog that has no evidence of rabies vaccine. So say your neighbor's dog bit you and they can't produce a rabies vaccination certificate. What would happen is you would file a bite report, and the owner would be asked to put their dog on a 10-day quarantine. And that can be done in the home in this county. Every county is a little bit different, but in this county, it could be done in the home. They have a specific set of rules that they have to follow to be meeting quarantine requirements. And then what would happen is at the end of those 2 days, someone from the health department calls that person, says, hey, is your dog, healthy, still alive, etc. Sometimes they'll even send an animal control officer or a veterinarian out to double check that. If the dog is healthy and alive and you were the one bit, you are at no risk of rabies. Because if that dog was shedding rabies when it bit you, remember, it will be dead in 10 days.
The severity of the bite, although significant initially in treating that, it's not necessarily the size of the bite that matters. Bats are generally 2 pinpricks that look very ambiguous, doesn't look like a big deal, but it is just as severe as the large bite from a fox. So the treatment needs to be immediate. You need to report to the doctor if you have the bat, that's great, but if not, you need to be tested immediately.
Now the incubation period though for rabies is very, very variable. It can be anything from a few weeks up to even a year, usually within 6 months or so. But if an animal is showing clinical signs, usually they pass away within about 10 days. And that's why the quarantine period for an animal that has bitten a human is usually about 10 days, once they start showing clinical signs.
Who can rabies affect?
So I was bit by a dog at my delivering pizzas job twice, and I didn't have to get a shot or anything like that afterwards, but the dogs did have to go through quarantine and they had to get their shots. They had to be up to date on their shots.
Fortunately, we've been vaccinated, and that gives you more protection, although if you're actually exposed to a rabid animal that's been confirmed, they still want you to get a booster vaccination.
So most grooming offices and dog kennels will require a current rabies vaccine in addition to many other vaccines that they require to protect their staff, to protect the other dogs or cats that might be there, and to also protect the dog, your dog who's coming. They want to make sure they're vaccinated and they don't get sick at their facility. Rabies is deadly and the vaccine is very effective.
The early 1950s, where rabies vaccination was required. And I think pretty much at the same time in Europe as well. Most of the developed world where rabies is a problem has a required rabies vaccination. Now in undeveloped countries in Africa, India, rabies is much more of a problem, and I don't believe they have a requirement for vaccination.
Prevent rabies. Keep your distance from stray pets and wildlife, and vaccinate your pets.
So that it's required by law to vaccinate all cats, dogs, and ferrets in the state of Maryland by the time they're 4 months old. So if a 4-month-old dog, let's say, is vaccinated, they're required to get a booster shot 1 year later and then every 3 years following that. So anytime your pet gets a rabies vaccine, they're going to receive two things. They're going to receive a rabies tag. So this is a metal tag that goes on your pet's collar. It has the year, the clinic where they were vaccinated at, as well as a unique number that's only on that rabies tag. They also receive a certificate. Some are electronic, but this is an example of a handwritten certificate book where you fill out the owner's information, the pet information, that unique tag number goes on the top, and it also says when they're due for revaccination. So this is what you would need to produce if your pet accidentally bit a person or another pet to prove that they're up to date on their vaccine.
The main thing is that it's very, very important that pet animals and livestock that are in close contact with people be vaccinated. Because that has greatly decreased the numbers of cases. And if there's at least 70% vaccination of pet animals, then it tends to reduce the number of human exposures. One thing that a lot of people aren't aware is that outdoor cats do a lot more hunting and roaming than the average dog. Like a cat outside at night can cover an area 2 or 3 miles, and they're actually more likely to come in contact with wildlife during the night than dogs are. In the wild, most rabies cases are in skunks, raccoons, foxes, and bats. And if the dogs and cats come in contact with those animals, if they're vaccinated and protected, then when they come home, they're not likely to spread it to the people.
So, there are between 20 and 40,000 people in the United States treated annually for possible rabies. The cost of that, depending on your insurance, can range anywhere from $280 up to about $10,000 to treat rabies. So prevention is the key.
When I was a kid, you know, they'd always tell you don't touch squirrels or don't touch raccoons or something because they could possibly have rabies, but I've never actually seen a case of it.
I would say always keep your animals vaccinated because if they're not up to date on their shots, they could be taken away from you. They could be put on quarantine, and if enough incidents happen, they could be put down.
We had 5 cats up until a couple months ago when one of our cats went missing, and we haven't been able to find her since, but there was a bit of a rabies scare in our neighborhood, and so people were because our cats are inside and outside cats, people would take other people's cats and go take them away because we didn't have collars on them, and so when there was a rabies scare in our neighborhood, they took our cat.
I just want to say that it's really important when you get a new pet, one of the first things you need to do is get them a rabies shot.